I'm sure you're not pleased and satisfied with the facilities, and the media have been reporting on cases like St. Teresa and others around the state, and there's been real outrage. Here's a comment from one of the kind of citizen advocates who said, "It's a terrible policy that we are moving coronavirus patients who are being released from hospitals into these long-term care facilities and assisted living facilities. It's putting coronavirus patients in these facilities is basically a death sentence." Is that true?
We don't believe that that is true. We do understand the questions and the concerns, and I can understand it as a family member or concerned citizen. It sounds like, why would you do that? In point of fact, we have no evidence of any outbreaks that have been caused by hospital to skilled nursing facility or assisted living transfers. But first, let me just back up and say you're absolutely right. I'm not for a moment suggesting that this is not a top priority to do everything we can to support long-term care facilities in caring for these populations. It's because of all the reasons that we talked about, the congregate living, the staff coming and going. As with other infectious diseases, every year we have flu outbreaks in these very same settings, and they are very vulnerable to infectious disease spread on a whole range of issues. So we've known that since the beginning and have been working, I think, increasingly effectively with these facilities to make sure they're using best infection control practices, that they have access to personal protective equipment and know how to use it. That wasn't the case early in the epidemic. So some of the facilities that have had large numbers of cases were among the very first, did not have all the support that was needed in terms of PPE and really vigorous infection control practices. But I'll just share with you that we've had a team of folks from the Centers for Disease Control and Prevention working with us here in Minnesota. And they've been here a couple times now. They were here in April. They have just been here the last couple of weeks, and they are really, they volunteered how impressed they were with the progress that's been made. And among the facilities that have a lot of cases, they have really gotten good at managing this. And they have, even with it's true, they've developed a lot of cases, but they've stabilized for the most part now. And the CDC folks even said, that I know it might sound counterintuitive, but that there's a real rationale for relying on facilities that have gotten very good at this to be sort of specialized places to care for these people. And many of them are doing so out of a real mission commitment.